Welcome, everyone. My name is Lily, and I am a parent advocate at Links CPRC. Thank you for joining this training on Oppositional Defiant Disorder, also known as ODD. Today, we'll explore what ODD is, what signs to look for, and how we can best support children and families affected by it. My goal is to leave you with practical knowledge and strategies you can apply in your work and personal life. Oppositional defiant disorder is more than just typical childhood misbehavior. All children say no and test limits at times, but ODD involves a persistent pattern of anger, irritability, and defiant or spiteful behavior towards others, especially authority figures. These behaviors last for at least 6 months and are intense enough to cause serious challenges at home, at school, and in relationships. Some common signs of ODD include frequent temper outbursts, being easily annoyed, and showing anger or resentment towards others. On the behavioral side, kids may argue with adults, actively refuse to follow rules, deliberately try to annoy others, or blame others for their mistakes. In some cases, children may even act spiteful or vindictive. What sets ODD apart is the consistency and severity of these behaviors, which disrupt daily functioning. Clinicians use specific criteria from the DSM-5 to diagnose ODD. A child must display at least four symptoms from the categories of anger, irritability, argumentative defiant behavior, or vindictiveness. The behaviors need to last for at least 6 months, occur with someone other than a sibling, and cause significant impairment in social, educational, and home life. This ensures that ODD is distinguished from temporary defiance or isolated incidents. ODD often appears in the preschool or early elementary years, though symptoms may continue into adolescence if left untreated. Studies suggest that about 1 in 10 children may meet criteria at some point. It is also important to note that some amount of defiance is normal for development, especially in toddlers and teens, but ODD is about persistent patterns that interfere with life and relationships. ODD doesn't have one single cause. Instead, it is thought to result from a combination of biological, psychological, and social factors. A child's temperament plays a role. Those who are highly reactive or easily frustrated may be more at risk. Parenting style is another factor. Inconsistent rules, harsh discipline, or lack of structure can increase the likelihood of ODD. Family stress, conflict, or instability can also contribute. In short, ODD is influenced by nature and nurture. The effects of ODD extend far beyond the child's behavior. At home, family relationships may become strained as arguments and power struggles escalate. In school, children with ODD often clash with teachers, resist classroom rules, and may fall behind academically. Among peers, they may struggle to make or maintain friendships, sometimes being seen as difficult or hostile. These challenges can create a cycle of frustration for both the child and the adults in their life. ODD often doesn't occur alone. Many children with ODD also have ADHD, anxiety, learning disorders, or mood disorders. This overlap can make diagnosis and treatment more complex. Without intervention, ODD may develop into more serious behavioral problems like conduct disorder in adolescence. That's why it's so important to identify and treat ODD early. Diagnosing ODD requires a comprehensive evaluation by a mental health professional. Clinicians gather information through interviews with parents, teachers, and the child, as well as standardized behavior checklists. The goal is to understand the frequency and severity of the symptoms and to rule out other explanations like developmental delays or trauma. Since ODD often co-occurs with other conditions, a full evaluation helps ensure the right supports are put in place for the child. The good news is that ODD is treatable. The most effective interventions focus on behavioral therapies. Parent management training, or PMT, is a cornerstone approach. This teaches parents strategies for responding consistently, setting clear expectations, and reinforcing positive behaviors. Individual therapy for the child may also help build coping skills, emotional regulation, and problem solving abilities. Let's look more closely at two evidence-based approaches. In parent management training, parents learn how to use positive reinforcement and consistent consequences instead of reacting out of frustration. The idea is to change the family dynamics so children receive more attention for good behavior than for misbehavior. Another effective method is parent child interaction therapy, which strengthens the bond between parent and child through guided interactions. Both these therapies empower families to handle challenges in a healthier way. Schools play a vital role in supporting students with ODD. Teachers can use strategies like consistent routines, clear expectations, and positive reinforcement to encourage cooperation. Collaboration between parents, teachers, and therapists is key. A team approach ensures the child receives consistent support across environments. Supporting a child with ODD takes practice, consistency, and empathy. Here are some practical tips. Set clear rules and stick to them. Use positive reinforcement. Catch them being good. Stay calm in the face of defiance. Escalating emotions usually fuels the conflict. Teach coping skills like deep breathing or taking breaks. Celebrate small successes. Progress often comes in small steps. Early intervention can change a child's trajectory. Without treatment, ODD may evolve into more serious disorders, leading to academic failure, strained family relationships, or legal troubles in adolescence. But with consistent support and therapy, many children improve dramatically. Early intervention gives children the tools to manage emotions, build relationships, and succeed in school and beyond. To wrap up, oppositional defiant disorder is a persistent pattern of defiant, angry, or spiteful behavior that goes beyond normal misbehavior. It impacts families, schools, and friendships, but is treatable with the right interventions. Parent training, school collaboration, and early intervention are the most effective approaches. Remember, children with ODD are not bad kids, they're just children who need guidance, structure, and support in order to thrive. Thank you for watching this training on ODD. I hope that you feel empowered to support your child or student and their ODD needs. If you need support or guidance along the way, reach out to the links CPRC in the Matsu Borough. You may contact us using the information below or scan the QR code to find us on Facebook.